Hello and welcome to Your Health Matters. You're watching Sun 20 TV and I'm Shari Einhorn. We have a great show for you today. I want to introduce you to my first guest, Julie Ratner, co-founder and board president of the Ellen Hermanson Foundation. Julie, thanks so much for stopping by.
Well, thank you for having me.
What can you tell us? First of all, tell us a little bit about the foundation. When was it started and what is its mission?
I started the foundation in 1996, a year after my sister Ellen died. And the mission of the foundation is to ensure state-of-the-art access to breast health care here on the East End of Long Island. That's kind of a muddled paraphrase from our website.
So when you started the foundation, was there a need for that on the East End specifically?
Yes, I think there was a great need. The rates of diagnosis and mortality are very high on the East End, and there were many fewer services at the time. Since we've been involved and we've been here, I think the services have improved greatly. We funded the Ellen Hermanson Breast Center at Southampton Hospital, which has been named a breast imaging center of excellence by the American College of Radiology. We've started psychosocial support groups, and we've created partnerships with local women's organizations to make sure that women don't fall through the cracks, especially women who are medically underserved.
I'm going to go backwards for a little bit because
Sure.
I think it's important when people start foundations in memory of a loved one. I like to know a little bit about the loved one. So can you tell us about your sister?
Absolutely. My sister Ellen was 6 years younger than I am. She was always smarter and taller and very funny. And she had the terrible misfortune of being diagnosed with stage 4 metastatic breast cancer when she was 36 and she had a 6-month-old baby. It was really a devastating diagnosis. At the time, I didn't know what I know now. And so it allowed me and my family, my mother, my other sister, to be very hopeful. Our father was a radiologist, and he had the grace and courage to keep the severity of her diagnosis from us. So we all believed she would get better. And she didn't. And in 1995, at the age of 42, she died. She used her time as a breast cancer survivor brilliantly. Professionally, she was a financial writer. She wrote financial reports for large institutions. As she became sicker, she only focused on what was interesting to her daughter Leora, and working in the cancer field. She edited a newspaper called The Outstretched Arm, and she was one of the founders of the Jewish Healing Center. She used her energy, her knowledge to advocate for other women who had breast cancer. So after she died, I felt there was work that was unfinished that she started. And I also felt that it would be horrible if her daughter Leora would say to me someday, I don't remember my mother. And so part of the reason for starting the foundation was so Leora would always know that she had a spectacular mother. The other reason was to continue the work she started that was so important to her. And I figured by doing that, her life would continue.
And how does the foundation specifically benefit the hospital and the programs at the hospital?
Well, our mission, which is really two-pronged, is to ensure access to health care. Ensuring access means there's an educational approach to it. There's also the approach to the equipment, and to the technology, which is what the breast center is. Early on, we created a collaborative working relationship with the hospital. And so when we realized there was a need for medical equipment and for a breast center here, and we slowly worked with the hospital to create the Ellen Hermanson Breast Center, which came into fruition into being in 2009. What actually happened is Bob Challoner, when he became the president and CEO, at the end of 2008, he said to me, I have a proposition for you. If you would fund a new state-of-the-art breast center, we'll name it for your sister Ellen. And it was a logical outcome because for years we had been funding different pieces of equipment for the breast center that would make it technologically advanced and competitive with other breast centers in terms of the quality of the equipment. And we knew the doctors were wonderful and the staff was quite wonderful and very accessible. So
raising money sometimes is a challenge, though. How were you able to do that?
It was such a challenge, especially if you remember 2008. It was not a great year in this country for the economy. I think because we were raising money for bricks and mortar, we were raising money for something that was really critically important. It is our opinion, when I say our, I mean the board of the Ellen Hermanson Foundation, myself, that access to health care is a human right, and that women who live on the east end of Long Island have the same right and deserve the same high level of medical care that you would find at an academic teaching hospital in New York City. And our goal, when we worked with Bob Challoner to fund this, create this breast center, we had two caveats. One is no one could be turned away because she couldn't afford to pay and she had no insurance. And the other was we wanted him to figure out how to marry the rigor of a teaching hospital with the warmth of a community hospital, so that when a woman would come into the hospital, she would feel that there's space being held for her, she's being cared for, that a frightening experience is maybe a little less scary for her.
Those are two big challenges.
They were big challenges.
Right.
And I think the hospital met them. You know, it's a work in progress always, and they cannot afford to sit back on their laurels, and neither can we at the Ellen Hermanson Foundation. Yeah, I was so naive when the breast center opened, I thought, my work is done. And then I realized it's not done, it's
right.
just beginning. The technology we bought this year, in 2 years, is out of date. There are new needs that are always being identified, as well as being responsive to the needs of the community, which is forever changing.
So it's also constant fundraising in addition to education for yourself and your board on the newest, the latest,
correct,
the best. But how are you able to raise the money? Do you mind if we ask how much were you able to raise?
Last year we raised over $500,000, which
wow.
I think for a little foundation is really terrific. Yeah, I'm always grateful for our supporters and donors and people who believe in the work we do. And we have made a point of keeping the money we make in the community. Mm-hmm. We feel that we're grassroots, that we are of the community and part of the community. And so I'm like the beggar in chief, really. You know, it's like I'm always looking for money. I just had to call Norsec for our porta potties today for the run. And I said, by the way, you could take a community sponsorship. You know, he wasn't expecting that. I said,
right.
I'll send you the information, because I wear different hats like everyone else.
Do you have partner organizations that you rely on?
We have partner organizations. I want to clarify, we have partner organizations that we work with and that we're funding because they're part of the community, and we have organizations that we work with, and I don't take anyone's generosity for granted. Every mm-hmm. year we go to organizations that have been loyal and supportive, and I believe in us, and we make a proposal mm-hmm. asking for funding. And with many of these organizations, they fund us year in and year out, for which I'm very grateful, but I don't take it as a given that this is going to happen every year and that I can count on these. So if you go to our website, ellenhermanson.org, you can see who all our sponsors are. We list them, we give them prominent play, because we're grateful and we want everyone to know who's kind and generous to us.
And how do you get the word out? I mean, shows like this, obviously the hospital, the breast center, but is a lot of it word of mouth when it comes to patients feeling warm and inviting, you know, at a place where they're warm, where it's warm and welcoming?
I think it's very important when a patient has a good experience and wants to write about it and talk about it, and we love having great testimonials. Mm-hmm. We're a small organization, and I think people feel that we're bigger because the team of people I have working with me is spectacular. Our executive director, Ann Gomberg, is just brilliant, and I think there's great synergy, and we're very effective. We have a wonderful person who helps us with our marketing, and we have another terrific person who does our creative work, who works on the website, who does our e-blasts. We do a lot of e-blasts. We work with some of the local press, and like everyone else, we get our advertising packages and we advertise. We try to do radio spots on local radio, and we try to barter because we want to spend less money right. and get more bang for the buck.
So tell us about the partner organizations that you help fund.
Okay, I'm very excited about that. And I want to just say up front that was really the brilliant idea of our executive director, Ann Gomberg. During COVID, when we first all went into hibernation, into quarantine, it gave us an opportunity to look at and reassess what we do and how we spend the precious dollars that we raise. And I think we've been doing some really good, important work before, we realized with COVID that more women were going to need help. Women were going to fall through the cracks. More women were going to be economically challenged. And we asked ourselves, how do we make sure to capture those women and bring them into the system? And it was really Ann's idea to look at some of the organizations in our community that are extremely effective and devoted to working with women who can fall through cracks beyond the margins. And we identified the center with Bonnie Cannon in Bridgehampton, the Retreat, OLA, and the Shinnecock Health Services as women who are often left out. And we created partnerships with these organizations. And through those partnerships, we have made grants to these organizations that they decide how to spend. It obviously has to be on breast health services. We don't know the community as well as they do. They're in a much better position to know how to spend those dollars and get women to come to the breast center, to come into the system. Because all this equipment, all the research that many organizations are doing, coming up with new treatments, new ways to help women with breast cancer, doesn't help the woman who doesn't know she might be at risk or have this.
And so you chose those three organizations, four organizations, apologies, specifically. And what is the feedback that you get?
I think this is our first year. I think it is working really successfully. Laura Borghardt, who is working with the Breast Center and also at the Phillips Family Cancer Center, is kind of spearheading, interfacing and negotiating and working with these organizations so that we're developing systems to work with these groups so that women have access to the breast center. That we also now have a bilingual, bicultural social worker who will work with women, because women who look like you or me aren't necessarily the right people to interface with communities of women. Well, you need someone from their community who can really be a trusted person.
That's part of the welcoming atmosphere.
Yeah, and who's culturally on the same page. And so we've worked very hard to do all this, to make sure that women feel that they're welcome. They feel they're in a safe place, someone who can speak their language and be understood to them.
What would your sister make of all of this?
I get asked this question so often. My sister, I think she would have a wry sense of humor about it and say, she would be a little bit in disbelief, because she knew she was smart. She knew she had a lot to say. On the other hand, she was kind of a humble person. And so to have all this happen in her name, I think would please her. I think she might feel a little over the top about it.
But she'd be proud and happy that women who perhaps weren't getting help before are getting help now.
Absolutely. She spent so much of her dwindling energy and time on making sure that women had access. And she understood, that as sort of educated person, our father was a doctor. She had the support of our whole family, who was with her. When she was having a horrible day, someone could be there with her.
Right. Not everyone is as lucky.
Exactly. And so she understood that. And she really tried to play it forward in such a significant way.
Julie Ratner, thank you so much for joining us and for telling us about the foundation and all the amazing work you're doing. We wish you luck in the future, and definitely stay with us. When we come back, we're going to learn more about lymphedema. We'll see you soon. Hello and welcome back. You're watching Your Health Matters on Sun 20 TV. We're going to talk about lymphedema, which is an important topic. Not a lot of people may know exactly what that is. Joining me now is Dawn Moore, a certified lymphedema therapist at Stony Brook Southampton Hospital. Thank you so much for taking time to join us. Why don't we just start right at the top? What is lymphedema in as basic terminology as you can explain for folks?
Lymphedema is an abnormal accumulation of fluid in our body that causes swelling in a body part. Easiest way to describe it.
Who might get lymphedema and why?
The most common cause of lymphedema is cancer. Cancer treatment, surgery, radiation. I think the number one is breast cancer. People can be born with primary lymphedema, very rare. And then secondary lymphedema is the more common way of acquiring it due to surgeries where lymph nodes are removed, scar tissue that impedes the lymphatic flow. The lymphatic system, its job is to take the excess fluid in our body, filter it through our lymph nodes, clean it out, infections, viruses, and cancer cells, and then resend that cleaned out fluid back throughout our body. So when lymph nodes are removed or damaged with treatments, there can be a backup of fluid, which is why people end up with swelling, most commonly in a limb, arm, legs. Can happen in other body parts, face, neck, with other types of surgeries, but most commonly in the arms and the legs.
It sounds painful.
Can be difficult. Many patients, or clients, first start to describe heaviness, weird feelings in their arms. We always advise people, seek treatment as soon as possible. Don't ignore those signs and symptoms, because yes, if it's untreated, ignored, it can be very debilitating and very painful.
So talk a little bit more about the symptoms or how people initially describe it.
Initially, people feel heaviness, fatigue, maybe tiredness in the arm. Many people come to me in therapy rubbing their arm, not being able to describe the feeling that they're feeling. We right away take measurements of the arm just to see if there is a true swelling issue. But pins and needles can be another feeling, heaviness, especially after they've been using their arm a lot.
Puffiness?
Pain, yeah, puffiness. Things to look for, people might notice jewelry starts to feel fit tighter, clothes are feeling tighter. Your skin might appear shiny. When there's swelling, your skin is going to stretch a little bit. So you might not see wrinkles or knuckles or veins. So these are all things that definitely don't ignore. I feel like education and awareness is really key with this. Many people just won't say anything. They won't say anything to their doctor. They'll ignore it. They think, it'll just go away. It can go away in the beginning. It can be reversible. They might notice in the morning it's fine, but by the end of the day, their arm is very, very swollen. Their skin looks weird, but then the next morning they wake up and it's kind of better again. But these are all things to look for and to be aware of, and just question your doctor, question your practitioner to see if it's something that they can get treatment for.
Now, you did mention a connection between breast cancer patients and lymphedema.
Yes.
So presumably that's something that a breast surgeon would tell somebody to be on the lookout for?
Yes, hopefully. I have been a physical therapist for 25 years. I was diagnosed with breast cancer 6 years ago. No one had really ever told me about anything like this. Thankfully,
Really?
I was lucky. I did not end up with lymphedema, but I was having some difficulty with shoulder range of motion, and that type of PT was beyond my scope. So I went to Stony Brook Southampton Hospital for treatment. This was before I worked there, because I wanted somebody to help me that knew what they were doing, which has changed my field of career now, because now I am breast cancer rehabilitation certified and also certified lymphedema therapist. That was in 2019.
So what kind of, I'm going to ask you, so since you're talking about the therapy,
Yes.
is therapy for lymphedema different than regular PT?
Yes, absolutely.
Okay.
Absolutely.
Can you talk a little bit about that?
Yes. So there's 4 gold standard components of treating lymphedema. And a certified lymphedema therapist goes through 135 hours of certification. We learn, I'll talk about the 4 components first. Manual lymph drainage, compression, skin care, and exercise. So the first one is manual lymph drainage. Our lymphatic vessels are very superficial, right under our skin. It is a special technique. It is a very, very gentle massage. It's not deep. There is a pattern to it to try to stimulate the lymphatic vessels and improve flow, maybe teach it a new pathway to go if there's been surgery or lymph nodes removed or radiation. So that's very important. They have a certified lymphedema therapist who knows what they're doing in that case. Compression, we also learn compression bandaging, because that can really help decongest and decrease the swelling. So we learn special wrapping techniques with special short stretch and elastic bandages to decrease the swelling, and then we refer people to a fitter who will fit them for a custom sleeve or stocking or a garment, because compression is very important with lymphedema. And skincare also important because the lymphatic vessels are so close to the skin. Dry skin can crack easily. You can get an infection.
Oh.
So we really, again, educate and teach people clean skin, moisturizing their skin, lotions with low pH, no fragrance, no alcohol, very important to keep their skin very healthy. And the final thing is exercise. So the lymphatic vessels do not have a central pump to pump the fluid like the heart with our blood. So it relies on muscle contraction to help stimulate. But on the other sense, you cannot overdo it with exercise. You kind of have to let that lymphatic system catch up. So it's very important to be kind of guided through a low, slow, gradual progression of an exercise program.
So is there a program available to patients at the hospital?
Yes. So we have 3 certified lymphedema therapists on staff at Southampton Hospital that will treat patients, and that goes through your insurance if you need treatment. But then there is also a exercise class that we had started. Tracy Sullivan, she's a cancer exercise specialist. We teach the class together. It was called Lymphedema Exercise and Education Program, which was a little long of a name.
Mouthful,
so
right?
we changed it to Fit and Strong. And it is an education exercise class that is taught Tuesdays and Thursdays. About 15 minutes, I pick a topic of the day. We talk about all these things that we're talking about, but I try to educate, find something that's of interest that I'm constantly doing research on. And then we go through an exercise class that, again, is very low, slow, and gradual. The exercises are pretty basic, but it's just trying to improve lymphatic flow versus lifting weights and cardiovascular. There's a little bit of fitness element to it, but it's very specific.
Can both men and women develop lymphedema?
Absolutely. Like I said, the most common cause is breast cancer, which men can get also. Other risk factors are poor circulatory and vascular issues, which is seen a little more commonly in the legs. But throat cancer, surgeries here, so obviously men and women there. Obesity and can be a risk factor because fat tissue and cells can also block that lymphatic flow, which is, again, exercise is very important.
Can you prevent lymphedema?
Can you prevent it? Again, education and awareness is key. We have been trying to start programs with some of the breast surgeons for me to meet with them even before their surgery, because there definitely are things that you can do to decrease your risk. Obviously, having surgery and lymph nodes removed is beyond people's control.
Right. What can they do?
But catch it as quickly as possible, because we can do the preventative manual lymph drainage massage to stimulate the lymphatic flow before you get it.
Okay.
We can teach people manual lymph drainage, which I try to encourage people to do every day. Wearing a compression garment. There's been many studies that if you wear a compression sleeve or stockings before you get actual lymphedema, they're doing studies with that now after breast cancer surgery, just wearing a sleeve 4 weeks after surgery, very, very low level compression. They're doing studies that maybe people are not ending up with lymphedema. So if people know that they are at risk, definitely come for therapy, see their doctor, things like that.
Once you get lymphedema, is it curable, or do you have it for the rest of your life?
Unfortunately, as of now, there is no cure for it. Treatment is to reduce it and hopefully maintain it. which is frustrating.
Does that vary with age at all? In other words, you had said previously that it can come and go.
Certain risk factors.
Right.
Yeah. The early stages are reversible. Unfortunately, the later stages are irreversible. You start to get skin changes. The lymphatic vessels just get very overworked and can't function the way they should anymore.
And so the four processes that you discussed earlier, are those considered the treatments? Or is there also medication or anything like that?
No medicine, unfortunately. Some people are put on water pills, diuretics. The lymphatic fluid is a little thicker than regular water. There's some protein in it, so those larger proteins cannot fully get through. So a water pill will take the excess water, but it won't allow those larger proteins to get through, and people can actually have medical issues after that with dehydration. Trying to stay hydrated, drink lots of water, keep moving, elevate as as needed. Just keep moving. It's the most important thing. I have people who wear sleeves when they're raking and gardening, but I also have people who wear their arm sleeves when they're doing computer work. Anytime your body is very stagnant in one position, you're at risk for that backup.
You said stay hydrated. I think that's confusing for people.
It is.
Because you have excess fluid in your body, but you're being told to hydrate. Can you just
Exactly.
explain that again so
Yes.
people get it?
Very controversial too,
Right.
because some people will say, my doctor said don't drink too much. Yes, there can be people who are on fluid restrictions, but the theory is if your body thinks it's going to be dehydrated, it's actually going to hold on to the excess fluid and it won't let it move. But if you stay hydrated and you're helping to eliminate some of that excess fluid, it is very controversial. People will argue with me on that.
Well, confusing
it's
for people, right?
very
Because you're talking
confusing.
about fluid. Now, the
Yes.
classes, the programs at Stony Brook, Southampton,
Yes.
is there a cost affiliated with them, and do people need to pre-register?
To pre-register for our Fit and Strong program, we have been mostly Zoom right now, but we are offering it in person too, but on a limited
Okay.
basis. So definitely register 726-8800 at the hospital. And it is a free program, which has been great. We've been doing it for about a year and a half now, and it is completely free, Tuesdays and Thursdays, 1 to 2 o'clock.
Thank you. And what's the reaction you're getting from folks in the program?
They love it. We're starting to pilot it to Stony Brook Hospital. I have a meeting tomorrow. The 5 ladies that have been consistent through this whole year and a half, constantly giving feedback. It's a unique program because there is a little more of a personal touch to it. I meet with people, I take measurements, kind of know their medical history. It's not just an exercise class where we want complete strangers in, because we don't want flare-ups. We don't want to cause problems with people's lymphedema. So every 8 weeks, I re-meet with them. We take measurements if they're interested in it. They've all loved the class. They feel better. Most women have. It is a class mostly of breast cancer survivors, not meant to be at all. They all feel improved range of motion and are very, very happy.
Great. Thank
the
you so
class.
much. Dawn Moore,
Thank you.
a lot of information. Thank you. So
Thank
helpful
you.
to learn about lymphedema. That's all the time we have, but we'll see you next time on Your Health Matters. Thank you so much for watching.
Funding for Your Health Matters is provided by Stony Brook Southampton Hospital. As part of the Stony Brook Medicine healthcare system, Stony Brook Southampton Hospital is committed to providing world-class academic-based medical care to our entire East End community.